Hi, welcome back everybody. Welcome back because seriously, you guys do not know just now what had happened since 5 p.m. until now. You guys really don't know, but we really make it on time. So seriously, thanks to the team, last minute, rush everything on time, rush to Dr. Ginny's clinic. And I'm so glad again to get Dr. Ginny's online today. And today's topic is really great. As this afternoon when I post in my Facebook, it recalls me when I was in Australia summer holiday, and I went for cycling and I went for I thought to enjoy the summer holiday. But the next day, actually, I hide myself and cried in the room for 2 hours because after the cycling, I know my pigment is actually just fully covered on my 2 cheeks. My both cheek is already full with the pigmentation. And for information, while cycling, every time when we rest, actually I did apply sunscreen which is more than 50 SPF 50. And yet I still got it. Lucky. That is actually because of the sun radiation or UV rays, which is caused me the pigmentation. But at the end, I still got my deep pigmentation. And thanks God, because of Dr. Ginny, she helps me to remove it with her great laser. Just now when I touch her laser, she scolded me, okay? She's not allowed me to touch her laser. All right, so are you guys ready to get Dr. Ginny's in? If you guys ready, can you guys type me something to let me know that you guys is ready for the questions. If you guys ready, please help me one thing before I put Dr. Ginny's in. One favor from you. I need you to help me to share this live because it definitely will benefit you, your mother, your sister, your BFF about pigmentations. All right. Oh, Vimin, you have shared already. That is great. Thank you so much. I love you, Vimin. You are always the most supportive. Thank you, Chan. Hi, Priscilla. We see you again. Yes. Because this afternoon we just did one live at 1 p.m. and now 6:30. As promised, we want you guys to share. Okay. So before I put the important doctor come to tell you what is about the deep pigmentation, I need to get a favor from you guys. Please help me to share this live to your mothers or mother-in-law or your sister-in-law, your sister, your BFF, because ladies we tend to have more pigmentations. Am I right?
Yes.
Than men. All right. So that's great. Last but not least, can I put Dr. Ginny in? Come in. Hi, Dr. Ginny. Fly in already. She fly in. All right. So
hello, everybody. Nice to meet you all again.
Yes, but if you don't know Dr. Ginny, please help her to share. I mean, for this live, we have prepared and we have before midnight we chat, we WhatsApp to each other. Hey, in how to improve the next session, how to improve the next session, So, and this session just came, and congratulations, it's the first day of MCO 3.0. Correct?
Unexpected, but we still make it on time.
We still make it on time.
Yeah, I flew in yesterday from Alaska actually, and then I reached safely in Subang.
Okay, that is one friend from Laka, Vimin. Say hi to Dr. Ginny.
Hi, Vimin.
Hey, Vimin, please get ready your questions. It's hard to get Dr. Ginny's answer precisely to your questions. Okay, so because I understand Vimin has some concerns as well, especially some of the scarring. I think she will ask something about scarring to become pigmentation or not.
All right.
Yeah, it's quite relevant to our today's topic as well. Okay, so what is the topic today actually?
Yeah, today, because last session we actually talked about the superficial pigment. Because initially I actually put the superficial and deep pigment together, but it's too lengthy, and then Pris said, why not we break into 2 sessions? So I agree with that. Okay, so that day we already covered superficial pigment. So today we'll talk more about the deep pigment. So just now Pris already mentioned that in Perth we got the sunburn. So if the sunburn from externally, initially we'll have actually is a superficial pigment. We call it PIH, post-inflammation hyperpigmentation caused by the sun damage. So it's not unusual for patient to have like straight away skin darkening on the whole face after a sunbathe, after an outing, or maybe after a holiday. I do have patient with melasma actually. Then I treated the pigment, but she went for holiday. She forgot to bring the sunblock, so end up she come back with full face of blown up of the pigment, like what you mentioned just now.
I hide myself in my room for 2 hours and cry non-stop. And look at the mirror, I cry again. Can you imagine that? I can understand your patient's.
Yeah, it's not unusual because sun damage is really very, very intensive, especially in Australia, because Perth they actually have the UVC leakage.
Yes.
They have a hole on the UVC, the ozone layer. That's why the sunlight actually is coming in very, very strong, and then the damage to the skin actually is more than
So from our friends here, she said pigmentation, our common enemy.
Yeah. It's my enemy as well. Yeah, I remember one time I went to Maldives, and then Maldives, so with all the sunlight and the beach. Okay, then I went for snorkeling. Okay, so after the 5 days, wow, very nice. Okay, the room by the beach side, and then every day you go and look at the beach.
360 degrees.
Yes. So after that you come back, so you have the extra bonus with you.
Is the free gift from Maldives?
Yes. Then at that time I do laser every week for 3 times. Then thank God, after 3 times it's all clear, because it's still very new pigment. So when I do it like regularly, then it's all clear.
Oh, that's great. Susan Low, is it your friends or your patients?
Wow,
she
from
said hi
Singapore.
from Singapore. Hello.
Thank you.
She say hi from Kuala Lumpur.
Yes, hi from Kuala Lumpur. Singapore is doing very well. No more MCO, and then you all are having great social life, not like us.
Yes, exactly. So that's why it's like one of the things that we need to learn from Singapore, right? So we have another friend, which is Makuta Joes. Hey Makuta, where were you from? If you don't mind, just to let us know where were you from, so that at least we can have or any concerns from you guys. You know what? Dr. Ginny is so friendly. It's always great that type your. I have a tips for you. For those who type any comment today or ask any questions today, we will select you to be the lucky winner of the
cash voucher.
Yeah,
we have the cash voucher for you to try our laser treatment. So I can reassure you, all the laser treatments here are clinically proven. The cutting edge technology. Okay, I always is very, very stringent in choosing the laser machine. Okay, I can try like 7 brands in the market, then I choose the best one, because I always want to give the best service and the best treatment outcome to my patient.
Just now touch only also kena scold already.
That is my lover. How to let you touch for fun? Oh, my machine is my lover. I pamper them a lot, man.
See, so tag 3 friends and share this live. Yeah, this is a basic requirement for you to have the chance to win the voucher. Okay. So the more question you ask, more relevant question you ask. Since you type hi, might as well you type me your questions. Okay. So then, because when you come here, it's already a great support. When you type the questions, then we know. And you know what? Because the more question, the more specific question you can ask, where Dr. Ginny can even more jump into your concern, and it's free consultation to you. Okay. So do we want to start the slide now, or Or
Yeah, I think everybody is still very
You guys-
shy. No
yeah.
question yet at the moment. So probably I can run through a few slides to you all until somebody has question. Then probably we have a pause and then we answer the question. Then we continue.
Is that
Is
all
that
right?
all right?
I think it should be fine. Let's share our slide. Okay, share. Ding. Can
So
you?
this is the
is
second session.
You guys can see it clear. You guys can see it clear. If you guys can see it clear, just one question. I read that our face would be numb while doing the laser treatment. Is it very uncomfortable? You got the great question, Ginny. You got the great questions. Okay, we will come to that. We cover that, right?
Yeah, we can answer that maybe later after we talk about the laser treatment. Yeah.
Okay, so shall we? For those who have questions, would love it. Please type as much as questions that you have while Dr. Ginny is starting her presentation. Okay. So this is Dr. Ginny all about pigmentation.
Yes, this is part 2. So a lot of time the patient will actually ask me, so is laser treatment why you hide yourself?
No, I put you as a main one, then I can do my work.
So is laser treatment actually mandatory for pigment? A lot of time patient will ask me whether I can use some creams or whether can I like do other treatments other than lasers. So that depends on the type of the pigment. Like the first episode when we talk about superficial pigment. So some superficial pigments such as like recent sunburn or recent PIH. So we actually can use some cream to actually help that. But when it comes to deep pigment meaning that the pigment actually is at the second layer of the skin. So the first layer is the epidermis. The second layer is the dermis layer. So when the pigment is at the dermis layer, you actually need to use laser to treat it because the cream can only penetrate to the first layer, the epidermis. So when talk about this, then people will ask me, so how can I know whether my pigment is deep or superficial? So of course, it's best that you can consult a doctor, whereby the doctor can actually check your skin properly and then to tell you whether that this is superficial or this is deep, it is what type of pigment, what treatment that you need. But today I will touch briefly on the common deep pigment that we see in our clinic, right? So treatment for deep pigment, like I mentioned just now, we need a laser treatment. So maybe some of you have heard about picosecond laser. So this is the this is the new kids on the block, whereby it's so popular in the market now. So picosecond laser is actually an ideal laser for deep pigment because the wavelength actually can penetrate deep into the dermis. Okay, so when we treat about the deep pigment, we also will do some chemical peeling to actually improve the skin turnover. So whenever the dead skin is removed, then when I do the laser, the penetration is better. So having said that, we talk about the deep pigment. So the common one will be nevus of aorta, Horace nevus, deep melasma. Okay, that day we talk about superficial melasma, whereby the melasma is at the epidermal layer. So usually the melasma at the epidermal layer, it can be caused by the sunburn or it can be caused by the wrong skin care. So when it is still at the epidermal layer, you can still like improve it with the lightening cream. But when the deep melasma occurs, so it's at the dermis, at the time maybe you need to do laser treatment. Okay, then this is another one quite common, the post-inflammation hyperpigmentation. It can be caused by pimples, so it can be caused by like wrong skin care as well. So when the damage is deep enough, so the PIH is at the deep layer. So tattoo, okay, a lot of time patient when falling in love, they go and tattoo the boyfriend name together with her name. Then after they break off already, they want to remove the boyfriend name. Okay, so we do use the laser actually to remove the black tattoo. Okay, so the nevus of aorta, so this is quite common in our population. So usually it's unilateral, only one side, black to grayish in color. Usually it's nearby to the eye area. So some of them will involve the eye white color, the white color of the eye. Okay, so that one is because the pigment actually is precipitated actually underneath the eye. So for the eye area, we can't do laser, okay, to remove the pigment in the eye. Okay, So what I can help is on the skin layer. Okay. So another one is the Horace nevus. Okay, Horace nevus usually is, just like I mentioned, the nevus of aorta is one side, right? Horace nevus is two sides, so it's on both sides. Okay, usually it's like quite symmetry, meaning that both sides is the same. But you see, this one left side is more than this one, so it can be like unequal, but usually both sides.
So it's like
this is what you have, low one. You are so sharp. I thought you fall asleep already.
I never fall asleep. You know how focused I am. Okay.
So actually, Pris has Horace nevus initially. So I think after we did 5 times, I think we did 5 sessions, and then it's almost all removed already.
This is what I have. Let me show you the happy face. Okay. Let me show you the happy face. So
yes,
previously, on my right cheeks, actually, it has quite obvious. Even though cover with the concealer, also is very obvious. People can see I have pigmentation. But after done the 5 times treatments, and I just use Kiss Mineral, just a light layer, it already covered up very well. And the best part is actually during the 5 times treatments, is actually quite enjoying, you know. Every time can come here and okay, Dr. Ginny, after done, we go makan.
Yes, that is the best part. Okay, so I got a lot of patients here become my friends, and then we go out and eat together. Okay, so we continue to the third one.
Okay.
Yeah, okay. So the pH, like I mentioned just now, okay, you can see here, this is pH caused by pimples, okay. So this is pH caused by wrong skin care. This one, yeah.
But this is very common. I think my mom is this.
Yeah, this is very common, yes. Because a lot of time you buy the skincare from over the counter. Now it's even worse. You can buy anything online. So today you Shopee, okay, sales 5th of May, special sales, and then you see this skincare, wow, so much promotion, and then you buy and try it. Because the problem is you don't know whether the skincare actually is suitable for your skin. So if the skincare have reaction on your skin, then after the reaction, after the redness subside, it can live with this pH. Post-inflammation, hyperpigmentation. Okay, so just be careful. So the back tattoo, you see this back tattoo is so beautiful, right? So think 3 times before you really go and do the back tattoo, because a lot of times when the patient comes for tattoo removal, I will tell them the tattoo removal is more painful than when you do the tattoo itself.
But doctor, if let's say we have a dark skin tone,
yeah.
So the laser experience really be different. Means that like when more tan skin really more tends to get burned. Or
yeah, wow, you are super smart, man. yes. What Chris voiced out is very pertinent. Okay, the fact is, the darker the skin type, your skin actually have more melanin. Melanin is the one who gives you the dark color.
Okay.
So when you have more melanin, when I do the laser, so it actually will absorb more laser energy, and then there is more heat production. So when there is more heat production, there is higher risk of pH and burn. Yes.
How patients knows whether she or himself is actually suitable, unless they come to.
Yeah, of course. So you have to see a doctor to actually assess your skin, to know your skin type. So for your information, skin type is using Fitzpatrick. Okay, this is Fitzpatrick type 1, 2, 3, 4, 5, and 6. So there are 6. Indian skin normally is 5 to 6. Chinese skin normally 3 to 4. Yeah, so remember what I said, it's normally. So it's not usually. So sometimes some patients actually at the lighter skin, they still prone for PIH. So a lot of time it depends on the skin texture. the elasticity of the skin, the collagen of the skin, the quality of the skin, and also actually the lifestyle, whether the patient actually have good sleep. Yeah, so the and good how to say the lifestyle of that. So a lot of time we actually prefer the patient actually to see us, see the doctor first. So the doctor will actually like check your skin properly and then see whether this is superficial or deep pigment, and then we'll check whether your skin is more prone to PNH. Then we will decide which treatment to use for you. So that's why I say that every of my patient we actually tailor make treatment plan for them. Not everybody is doing the same.
Okay. So means to say, because just now you have mentioned a few types of the pigmentation, so I think we put a stop there.
Yeah.
So maybe like
let them
digest, and while let's say like Dr. Ginny just now has mentioned, we have 5 types of different skin types. So
1 to 6.
1 to 6. So this is one of the question: what types of skin do you think you are? You know, like just now, Dr. Ginny also had mentioned Chinese will be under 3 to 4. What about Malay?
Indians is 5 to 6. Malay is 4 to 5.
4 to 5. Okay, so if you are fair Malay, means that you're under 3 or 4, right? So you are still able to go through all the laser treatments.
Yes.
What if they are actually category under 3, and they went for like you said, go to Maldives after come back suntan.
Okay, because the lighter the skin, actually the how to say, the lighter the skin, the better the recovery from sunburn. So skin type 1, just like the Maksale, okay, just like the foreigner Caucasian, okay, they actually they can get sunburn as well, suntan as well, but then their skin lighten very fast.
Yeah.
But then for skin type 6, the Indian dark skin, okay, it's actually sometimes it's difficult for them to get suntan, okay, because they got a lot of protection from the melanin that they have. But once they got the suntan, it's very difficult for them to lighten back.
Cool.
Yes.
So far, you guys still follow or not? You know,
is that too complicated
or is it too deep or too classic? You know, when it comes to this,
too educational.
What black tattoo lah, deep pigmentation lah, and just now some of the pigmentations name also I also cannot pronounce. Okay, you guys so far so good. At least type 1 to make us 2 of us understand that you guys still alive there, or still following us there. You know, so at least we
not fall asleep.
Yes. No, you guys must understand this Facebook Live. Yes, is both of us chit chat. But the most important host is actually you guys, right? So if you guys can give us some interaction, that's why it will be very, very great. All right, Vimin said she's still following. She typed there 1. No, she typed there 1. Okay, so Vimin still following. What about the rest? Chan also following. Okay, Mabisha Budana also following.
Thank you.
Awesome, you guys. So that's why the more things that we be interactive, we make this life more lively, and it's not only 2 of us. Our topic.
Yeah, we are not talking to the computer.
Yes.
No, we feel boring when we talk to computer. We want to talk to human beings.
See, so let me go through some questions. Share already. That's perfect. Bimi, hi, Dr. Ginny. I think okay.
So I read that our face would be numb when doing the laser treatment. Is it very uncomfortable? So you can actually choose. If you don't want numb cream, that will be more painful. So whether you want a painful experience or you want a numb experience. Yes. So I can assure you it's not uncomfortable. You actually practically, you won't feel your face so much, especially near the mouth area. But then you can still move, you can still kiss your husband, don't worry.
Don't worry, when your husband, when he kisses you, you still can sense the kiss, okay? You still can sense it. So because I put numb cream before while doing my laser, right? To be serious, when you touch me, I still feel one, but it will not that painful because I have this experience before. Last time when the ex company when I work with, we are selling laser machine as well, right? So you know what? How tango we are, we go without numbing because we want to know how to sense the painful. I can tell you, damn pain, you know.
So Vivian, I can tell you, I never torture my patient because I'm that type of person very scared of pain. So I never want to make my patient painful.
Yes.
So I will always take care of my patient. I put the numb cream. They wait for half an hour, then we do the treatment.
Yes.
The fact is, the numb cream only lasts for 2 hours. So however uncomfortable you are, it's only 2 hours. After that, you will have full recovery of your sensation. Okay,
it's quite comfortable so far.
Yeah.
If you ask me, because I go without numb cream before and go with numb cream,
so
of course
numb cream, you want numb cream, right? Yes.
It will not harm your skin. It will not harm to your health as well. Don't worry about it.
Yeah.
Right. Susan Law, heard about you from Facebook influencer in Malaysia.
No lah, I'm not influencer yet.
No.
But I'm going to be.
Wow. So you must thank you, Susan. You know, share more.
Yeah, please share more.
Who push her to be KOL as a doctor because we need to be honest. Doctors, you have such a great experience. It's always great that you share your experience to all of us, and that's why you know it's actually a very priceless or very valuable for us to know what treatment is correct and what treatment is wrong, right? So if you guys agree with it, please help us to share this live more.
Yeah, share and tag your friends.
Yes,
okay, so that more people actually can enjoy this talk.
If you guys want to, you're from Plant Valley, if you let's say you think that okay, then I redeem first, I can do after MCO. Please ask as much questions that you have, then we can actually who knows, Dr. Ginny very happy she will choose everyone as a winner also. Correct? Lisa, hi Dr. Ginny. Okay.
Hi Lisa.
Mabisha, it is true that after laser our skin can have pigmentation easier. Oh, it's okay. Mabisha, thanks for coming in. Thanks for joining us. You know, another half an hour you will go for buka puasa already. So please, take these 30 minutes to be with us so that at least you can have more information before buka. Okay?
Okay, this is a very common question lah. So the question is it true that after the laser, our skin can have pigmentation easier? So what actually she means is it the skin become like more vulnerable and thinner after the laser? So I actually have, I think a short video talking about this. Yeah. So you can actually know more about this in my Dr. Ginny Facebook page. I actually have regular posting for Dr. Ginny Health Tips channel. So I actually talk about if the laser treatment will cause skin thinning. So that depends on which laser that you use. So a lot of time for pigmentation, I hardly use the invasive laser, meaning that I won't use the laser which can hurt your epidermis, which can hurt your skin actually. Because the pigmented skin is actually already injured and then causing the hyperpigmentation. So you don't want to further damage it. So I usually will use our bestseller Radiant Smooth Laser, which actually is a soft laser. So after you have the hyperpigmentation, we actually use this soft laser to lighten your pigment without any redness, no peeling, no swelling, no pain. So this soft laser is my bestseller here. So if you have the deep pigment, I will add the picosecond laser. So all this at the correct interval with the correct energy, it won't cause skin thinning and then definitely won't cause like the skin become like easily get pigmentation in the future. Right.
So still can digest or not? Still can digest or not? I believe that is a very good questions from all of you. Very Rachel about pigmentation. Maybe Makuta, thank you for sharing and tag your friends in. You must be aggressive to get the laser treatments. 168 cash voucher. Okay, Mabisha, thank you, Mabisha, for the hi.
Then we can continue. Okay, most of them is
they still have a lot.
Okay. This is the interaction.
What about this? Okay. All right, that's great. All right. That's great. All right, then we continue.
Mm.
Yeah, we continue our slides. Stop screen. Nope. You want to share screen? Okay. Can see?
Yes.
Okay.
All right. So I think I shared with you a few of my experience so that you can know what to expect. A lot of time we tell patient, okay, you have this pigment, okay, maybe after 5 sessions, then you will have the skin lightening, all that. Then patient will ask me, is that 100% clearance? When I heard 100%, I said no. Okay. So we have to be practical, okay? We wouldn't like over-promise the patient. I usually will under-promise and then I will over-deliver, meaning that I will give you more surprise for you. Okay, so I can show you a few of my experience. So like just now I mentioned, the liver sabota is the one-sided like pigmentation. So this patient at 14 years old, actually seen me I think 4 years ago. So she has birthmark at birth, progressively increased with her growth. So I proposed to her at that time, I don't have my picosecond laser yet. So at the time I used my nanosecond laser. So I proposed to her actually she needs 20 sessions at 2 to 3 months interval. So I explained to her why we need so many sessions, and then I explained to her why because the pigment actually the pigment load is a lot. So we need to do it slowly to actually get rid of the pigment.
Is she considered dark skin tone?
Yes, this is considered dark skin tone.
Wow.
So this is the nanosecond laser. So this is before I install my picosecond laser. So you can see it's within 2 years. So this is the progress. She has done about 15 times of the nanosecond laser. So usually she will come with the mom. So both the mom and herself actually is very happy with the result. But I'm not happy. So you see, after 15 times, I can still see the remnant about 20%. Yeah, and then I can see that actually the skin tones is not so equal. So this will happen with the old laser. The nanosecond laser is bound to have some unequal skin tone because the laser energy it is a bit like 2/10 for the pigment. That's why now I install the picosecond laser. This picosecond laser actually the damage to the melanin is not so much, so it won't cause so much of uneven skin tone. So this is how she after the 3 times picosecond laser.
Wow.
Okay, so I add another 3 times. You can see the skin tone is so much like brighter, and then also the uneven skin tone is so much better.
To me, it looks like a bleaching.
No birthmark already, right?
Yes.
No birthmark.
It's like she have drunk the whole bottle of the bleach.
Yes, but this one takes about 2.5 to 3. I think 3 years. Yes, this one takes.
But she's very persistent.
Yes, she is very persistent. I think she is an athlete. So initially, like what you say, she has darker skin type, and then I'm a bit worried for her. And I said, better after my laser, you actually like absent from your practice for some time.
Under the sunlight.
Yeah, because it's an athlete, so she actually practiced a lot. So this is what we can achieve. Of course, not 100%, but I would say this one is about 90% clearance. And then patient actually can, a lot of her friends actually can say, oh, how come your birthmark disappeared?
It's actually like a 2-person, you know. You can see the before and after. You can see the confidence level has been raised as well.
Yes. She actually recommend a lot of friends to me as well because she actually have the confidence, and then she never expect that this birthmark can be removed.
You guys see it, right? So please help her to share this again, share this live again, so that we can benefit more people to treat the deep pigmentation under the proper and the correct way, right? So please help us to share more, please, and more questions, please. More questions. Okay.
Yeah. So this is my patient actually in our star. Yeah, in my HQ in our star. That's why you can see it's my skin. It's not Dr. Ginny. Okay. Yeah. Okay. Then I have another case that is the same as your case, Horace Neighbors. Okay.
Don't worry, this is not me.
Okay, this patient at the time I'm still very new, so I do not have the serial picture. Okay. So you see how bad is Horace Neighbors. Okay. So that's why she needs about 7 treatments. So after the 7 treatment, you can see it's almost cleared off. Yeah, it's about 90% clearance. So this is what we can achieve. Okay. Okay, so this is another case is regarding deep pigmentation of like PIH. Like what I mentioned just now, it's quite common. This patient actually has peeling and redness post skincare from online.
Biasalah. This one is what people. My friend said this is very good. Then buy together.
Yes, buy together, buy online.
Use together, and then without anyone proper guide.
Yes, then Shopee every month also get promotion, and then you got more. You buy more and more, and then.
And I notice this a lot. People will do it like when I see sometimes they love it and they continue use it. But when the distance, when we can see the skin reaction, it's not just the skin, it's become a pinkish skin. And I can feel that it's very horrible because of the pigmentation and also
the skincare actually which contain about acid or contain like high chemical or that actually burn the skin. Yes, then after burning, she go and do laser in MediSpa Center. So for your information, not everybody can do laser. Not everybody have the license to do laser. Actually, Ministry of Health already implemented that only those doctors with license of credentialing and privileging, which we call it LCP. Only those doctors with LCP can practice laser treatment, injection, Botox, filler injection. So if anybody have no license and then they practice this, actually we can report to the Ministry of Health and then their center will get red and tutup.
But Dr. Ginny, a lot of times when women are, when desperate that time, they always forget about this, what's the right step they have. Because when we meet up with friends, the friends say this is good and bring them, then the person just wear a doctor's, coat. And say, I'm a Dr. Ooi. But when the time is like, the outlook is already convinced, we always forgot to check. Hey, doctor, do you really have it? Show me your identity or show me your license.
Please do that. Please do that. I have no problem to show you all my LCP. Okay. So you actually please have this practice to actually ask the doctors to show you the license. Clinic need to have 2 licenses to actually practice aesthetic. First is the clinic registration license. Second is the doctors with LCP. So you need these 2 licenses to actually practice aesthetic. So please, help yourself. To actually have this practice to check.
And you have the rights, just like you buy any products over the counters or from online, you have the rights to ask. What is your full ingredient? What actually you license? When it comes to clinic, you cannot just like put I'm clinic Ooi and then come in. You trust that is already the Dr. Ooi. We have a lot of doctors, okay, but it's just like we have the rights. I would say we have the rights to ask.
You need to check when you buy an LV bag. You have to check that is a certificate, that is a guarantee card inside. When you buy a Rolex, you want to check the license. Why when you go to clinic, you never check the license? You just trust that from their signboard and then you thought that this is the correct
friends introduce,
So when you have the complication, you need to buy, not the clinic. Not the center, okay? So that's why to protect yourself, you actually need to check it. So this patient actually done in another MediSpa center. Okay, there are so many MediSpa in the market. Okay, they claim that they are doctors, but when you are doctors, you are supposed to practice in a clinic, not practice in a beauty salon. You are not supposed to practice in a beauty salon.
Some of them even go to hotel room.
Yes. Please report to Ministry of Health and then get them catch into the jail.
Yes. Hey, we have read so many cases from newspaper, pass away in the theater, just because now only I know they are beauticians. Sorry, I'm not against any beauty salonists here, but we need to know what is our own rights. This is what we wanted to bring it out. Right? I think this is a very
there are so many like beauty salons in the market. I'm not like looking down on the beauty salon, but beauty salon, you need to know what you are supposed to do, what you are not supposed to do. Yeah. So when it comes to injectables, when it comes to this laser machine, actually, is only can be done by professional aesthetic doctors. So this patient come in, actually, I started her on the picosecond laser with radiant smooth laser and some oral supplement to actually improve the healing.
Combinations of therapy.
Yes, combination treatment. So that's why I say that not every patient will do the same treatment. So we actually will see, like, we'll get a tailor-made plan for the patient. So after, I can see that after 2 sessions, so this is the darkening. So after 2 sessions, actually the result is quite good already. But after 4 sessions, you can see the whole face, the skin tones become lighter.
And the skin become tightening.
And then smoother.
Yeah. You can see the jaw, the cheek lines is actually
so it's like because the laser actually can stimulate new collagen, so there will be some lifting effect as well.
This is what ladies love to hear.
Yeah.
Stimulate collagen.
Yeah, stimulate collagen. So you can see the pigment here. So after 2 sessions, after 4 sessions. So I would say this is very good result with not only we target on the pigment, we actually improve the whole skin tone. Yes.
You pay for one treatment, but you get more.
Got more benefit because I will tailor make the treatment plan for you. Yeah.
That's awesome. Black tattoo.
Yeah. So after the common PIH, after the uncommon, not so common like Horace Neighbors that what Chris have, then with this one we are quite iatrogenic. Iatrogenic, you know what is that means? That is not caused by your genetic. You actually do it yourself. You actually pay to do the black tattoo, and now you want to remove it. So I do have a few slides to show you all. This is after 1 session. You can see it's so beautiful. Yes. So I tell the man actually, why not you keep this? She said that feng shui sifu say this is not good. This is harimau, okay, not good. The tiger is not good for me. Okay. So I remove. So this is after 1-time treatment. But this patient, after 1-time treatment, I think after the 2nd session, she actually defaulted the treatment. So I can only show you the 1 treatment. So, but you see that the 1-time can actually lighten about 30%.
I think more than that.
Yeah, so it actually lightening is quite good.
Yeah,
this one we are using the picosecond.
Oh.
Yeah.
Wow.
So this is after 1 session.
So again, the feng shui sifu said no good on the eagle. So before the moral is before you do tattoo, you ask your feng shui sifu first.
Ask your feng shui sifu first. Yeah. So this is another one. Okay, this one is from the temple. So a lot of time they actually like to tattoo some. This one I don't know how it calls. Some
discolorations.
No. They want to do something.
Oh, the chanting.
Chanting, yes.
Yeah.
The chanting. So they want to do the chanting actually to protect and then to give them more prosperity or something like that. Yeah. So, but then somehow rather, I have a few already, and because in our school actually a lot of them actually got this chanting tattoo by the semi in the temple. Then after some time they just don't like it, and then they want it to move.
Or they want to enhance it, or
no, they said the chanting is no longer protecting them, and then they want to get it removed.
After
so some is at the arm, some is at the back. This one is on the hand.
After you meditate.
So this is after 2 sessions. So deep pigment actually, like I cannot promise you like how many sessions are needed. So that will a lot of time depends on the density of the pigment, and also your body metabolism, and also your lifestyle, how good you actually take care of your skin after I do the treatment. So we actually communicate closely with the patient. After each treatment, we actually closely monitor them, come for follow-up, then we monitor the progress, then we progress from there. That's why we actually need to have the passion actually to treat the pigment sincerely, I would say. Yeah.
So, like doctor, if let's say the patient has diabetes or high blood, especially diabetic, is it advisable for laser treatment?
Okay, if the patient is diabetes, so the only concern that we have is if the laser is creating any wound, any injury, will it like delay the healing? So a lot of time when I do mole removal, because mole removal I practically need to burn the bone, so that is actually a open wound. Then that we actually need the patient to have a well-controlled diabetes. Then I also will have like extra precaution for them to give them some antibiotic cream after the laser treatment. So that is for invasive laser. But for pigment, we are using non-invasive laser, so actually no problem for any diabetic patient to do it because there is no wound at all actually.
Okay, good. Any more before?
I think finish.
That's awesome.
Finish.
That's awesome. I think stop sharing. Let's come back. Yeah, back to the original world. Okay.
Back to the original one. No more slides, so you can see both of us more clearly.
Yes. So Chan did ask, is dark eye circle pigmentation?
Wow. Okay, dark eye circle treatment is another signature treatment in Dr. Ginny clinic. Because a lot of time actually, I don't know whether it's the other doctors don't really like to do the eye circle or what. So I actually have special passion to do the eye circle treatment. So I actually have the special tailor, secret recipe to actually treat the eye circle. Of course, the eye circle we need to know the underlying causes. So the common causes will be whether you have makeup which has chemical, we actually cause darkening of the eye circle. So when that is the case, have to go to Kiss Mineral. So Kiss Mineral, the makeup got no chemical. So I usually will tell them, if you really insist want to put eye makeup, please use chemical-free eye makeup. That is the Kiss Mineral.
But the thing is, a lot of them they do not know how to separate it, how to know what is the category of the safe color or non-safe color. To them, it's like when they put eye makeup, they want it to be long-lasting, to look gorgeous, look stylish, you know. But they always put that as the last concern. Makeup got safer one. They do not know. A lot of customers do not know actually. Mineral colors is actually the alternative for the synthetic coloring. So yes, because why all this is transdermal effects. When you put your red shirts under the hot suns, it actually faded more faster than others' color.
Yeah.
Right. So imagine you put the blusher on your cheeks. It's actually transdermal effect, so it causes you more pigmentation, high risk on it. Yeah, so that's why this is one a bit of commercial break here. But
not commercial break. This is very true actually. I actually tell my patient there are only 4 main factors for the eye circle. First is eye makeup, so that is actually preventable. Second is genetic. Genetic non-preventable. You cannot change your gene. Okay. The third one is if you have sinusitis, because once you have sinusitis here, the circulation is blocked. Then the whole eye, the circulation also will be blocked. And then when you have poor circulation, then you have the eye circle. Okay. The fourth one is frequent rubbing of the eye. So when you frequently rub your eye, somebody just have the habit. Whenever they wake up, they want to rub their eye. So if you have this habit, you actually will cause more the eye circle problem.
So how to solve that? Put lashes.
Put lashes and cannot rub the eye. Yeah.
You got it. Okay, Susan said good job.
Thank you, Susan.
Any more?
Thank you, Shavita.
Oh, Shavita is here. Okay, that's great. And another question, Adila. I heard somewhere that acne is also a major risk factor for developing high pigmentation.
Yes. If you saw my slide just now, so one of the slides actually showing the pimples. Each pimples, after healing, you get a bonus of black marks or red marks or depressed scar. So I always tell the patient, you don't go and pick and then don't go and extract the pimples. After the extraction, you only have 3 destiny for the pimples. First is live with red scar. Second is live with black mark. The third one is you live with depressed scar. So all these 3 you do not want it, so don't go and extract it.
But difficult to hold it, you see. It's like itchy fingers.
It's okay. So when you have the black mark and red mark, you just need to pay to come for treatment.
And relax yourself in Dr. Ginny's right? Many are not licensed. Yes, you are right, Savita.
Yes, Savita actually do a very extensive research, see many doctors before she come to me.
And finally, she finalized Dr. Ginny is
And then I have to tell you, she is a licensed lawyer.
Licensed.
Transparent. Yeah. You check before you come in, right?
I think Savita, you got it. You bring it out very good point. I think because a lot of people they come in because to them it's a certificate, but because you are professional as a lawyer, you know which certificate is a true certificate, right? So that's why when you spot on, you know this is the place that you can stay and to do continue your treatments. Right, we have Bimi. Do we need to use a special skincare for life after pigmentation treatment?
Wow, you ask very fantastic question, Bimi. I like it so much. All right, okay. A lot of time the patient actually will come for treatment and then they say, I got my own skincare. I have been using my skincare for 20 years. My skincare is SK2, Estee Lauder.
My skincare is from Japan.
Yeah, then a lot of them actually they have all the expensive branded skincare.
Yeah.
So my only concern is when your skincare have no acid, no heavy metals, carry on. I got no problem. I got no problem for you to use a skincare which you are really very comfortable with, and then you are very sure there is no acid content. Yeah, just like Chris, she's using her own skincare after my treatment. I got no problem. I never force the patient actually to use my skincare. But when you are not sure whether your skincare has acid content,
you need advice. You need someone to give you a confirmation. Correct skincare.
Yeah, so when you are not sure, so I would rather you change to our skincare. Okay, so our skincare actually is Ministry of Health approved. Secondly, it is have no acid content. I am anti-acid here. Okay. Then also our skincare actually I have been using for 12 years already. Those not good one already kicked out during my first 2 years. So now the skincare that I'm using is already continuously like serving my patient well for the past 12 years.
Awesome. Savita also have another question. Do you have before and after picture for the eye circle?
Okay, the eye circle we cannot show you photo because a lot of time we actually get the consent of the patient to show photo with the condition that we close the eye. So the eye circle is a bit difficult for me to get photo because a lot of time after the treatment the patient actually refused to show the photo. But I do have a few that I can show you in my clinic.
I think the rest is also Savita. Just send the love. Yes, I did. Yes. Well, that's great. Savita, you are awesome, Savita, to be serious, okay? So, I think we also almost end. It's supposed to be 45 minutes, but we always assess time one. So, but it's
not too much.
But I love it because this is what I call interactive, you know.
No stress. I feel so how to say, so relaxed to attend this live, and then no need to really prepare it. I just prepare the slide and then come and chit chat with Chris, and then that's it. Then everybody benefit. That's good. Yeah.
So those who actually have shared this live and tag 3 friends, and of course, admin, we have a job tomorrow to go through those who have done it. If we have contact you or Dr. Ginny's admin team has WhatsApp you or for further questions, means that you have done so. But if you have not received any notification from any party from Kiss Mineral or Dr. Ginny's clinic, means that you have not done effectively lah. Yeah. So
so today is very simple. Last session we had question to ask.
Yes.
Today there are no question. You just need to share and tag 3 friends.
Well, before the live is ending, you still have tag your friends here. Means that you tag your friends means that you put your friend's name, 3 friends' name here. Then you share this page too. But if you share out this page, it has to be public. Do not share only private, okay? Otherwise, we also cannot see. We cannot check as well. Then we will disqualify you. For me, I do share a lot, okay? I do share a lot while Dr. Ginny just now is talking about it. So
you get the prize, no?
So I will redeem the prize. So I think this is the something that we can have interactive and what is the next topic?
So what do you guys want me to talk about? Give me
Yeah.
some hint. I get some idea from you all. I can talk anything that you want.
Pigmentation, we talk about light pigmentations, we have talked about deep
Pigmentation,
pigmentations,
yes.
and we have mentioned some of it is like the laser meat. We have also add in some of the for some of the what to say the wrong perspective from your side.
Yes.
Yes, we have clarified. I mean, Dr. Ginny has clarified. So, what is the next topic? Is it acne or is it
So let them have the ground. Let them have the say.
See, you guys is the boss.
Yeah, I say already. You guys is the boss.
You guys is the boss.
But if you guys too shy, then
because
I also got no mood to continue the third session.
Oh, don't be like that. No, so you guys better because I think now is buka puasa, so that's why the viewer also has left. Some of the viewers left. But those who are here, you know, Savita, Bimin, or Chan, or Adila, or Makuta. Just now I remember some of the names.
Can you recommend a good cleanser?
Jennifer. Jennifer got, since you know doctor from the KOL friends group or any things that you wanted to know. Makuta Sabah ada di Sabah adakah? Sabah tak ada.
Sabah tak ada. Ada dekat Alostar dengan Subang sahaja.
Ya, okay. Sabah belum ada lagi.
Tunggu rezeki.
Tunggu rezeki. So, if let's say for you, doctor, your expertise is about pigmentations.
I wouldn't say expertise. A lot of doctors actually can treat pigment. It's maybe my passion is in treating pigment and pimples. So I think the next one I will talk about pimples. Pimples is very common among our population because of our weather, our diet. Okay, then now we got additional bonus to get acne is because of the mask wearing. So we call it maskne. Yes, this is the new word after COVID-19. Then we have the maskne. Yes. So I think next session we'll talk about pimples. Is quite annoying like problems because with pimples you can end up with like hyperpigmentation, you can end up with red scar, you can end up with depressed scar with all the holes on the skin. So I will go through like how to actually take care of all this before we actually get it worsened.
Okay, so I hope you guys are okay with it because I remember Bimin did ask before about scarring or from the acne, and because her son also have oily skin. She bought the setting powder and give it to the son, and the skin has improved tremendously.
You see, no need to see me kiss mineral.
But of course, you must get your advice. You know, like how to prevent oily skin, how to prevent the acne. Because I have a friend or she previously she has acne not that often. But lately, seriously, I do not know what has happened. Non-stop.
So you have to see whether it's at the mass distribution area. No, whole face. Include here, then maybe it's not because of the mask. Maybe because of the wrong skincare. Maybe because of the hormone. Maybe because of the diet. So I will talk more about this during the next session.
That'll be great. Yeah, Adila, I remember you have asked these questions. Okay, Savita, she asked.
Can you recommend a good face cleanser? Yes, please come. My staff will serve the best face cleanser for you at a very, very affordable price.
Yeah, cleanser is using every day, right?
Yes,
so
yes,
that's why
yes.
It's,
we do have a few cleansers that is very, very easy to adapt, and then your skin actually will feel very, very comfortable with.
Okay, 7:30. I think.
Well, today we overtime.
Overtime. So, but it's a great sessions again. So we see you next.
So we have to tell them when are we closing the share and tag three friends.
While we are, when this live end means it's end already, lor.
Then hopefully I can get some winner. We actually need to check whether you share and tag 3 friends. Then after that, Kiss Mineral will actually get the winner, and then we will privately contact you all.
Because usually Dr. Ginny comes every 2 weeks, right? So 2 weeks after is like almost ending of the MCO.
Yeah, if it's not extended.
Okay, so tentatively we will set about before end of May lah.
Yeah.
Right?
Yeah.
Before end of May we will announce
we'll have
again.
Our next session.
Yes. But wish that you guys and seriously hope that you guys enjoy this session and have a good weekend. Weekend is coming. Yeah, tomorrow is Friday.
Enjoy your MCO. Okay.
Yeah.
MCO, you work from home and then you practically like eat at home and then cannot dine in outside. So you got more times for yourself.
Yes.
And then you got more times to do the things that you not usually have time to do it.
Okay, so Chan said loving it. Thank you so much, Chan. Thank you so much, the great hero just now who sent the monitor. Okay, thank you so much. I have a really great sessions. Thank you, Dr. Ginny, for your great time.
Thank you, Chris.
Seriously, hopefully next time we can do more. We get more ready of the questions. Then we can get more interactive.
All right.
Okay.
Okay. Have a
Thank
good day.
You so
Take
much.
care.
Prettiest. Okay lah. You win, Chan. Bye.
Bye.